Hello everyone and welcome back to my channel. So we are going to start unit genetics from pediatrics and we will discuss the topic Turner syndrome, Down syndrome and Klinefelter syndrome in this video. So we are having a scenario from Turner syndrome that there is a 15-year-old girl presented with complaint of short stature. On examination, she has webbing of the neck and poorly developed secondary sexual characters. There is no history of menarche. There is history of edema of hands and feet at birth. So, what is the diagnosis, the investigations, and other associated problems and the treatment? So, the diagnosis is the Turner syndrome. Is there is short stature present? And webbing of the neck and poorly developed secondary sexual characters are present, and there is no history of menarche. So this is Turner syndrome. Now, what are the investigation options that are done for this syndrome? These are karyotyping will show 45X chromosomes, and buccal smear of the sex chromatin is useful. Now, the supportive investigations are echo, ultrasound, RFTs, blood glucose, blood pressure, hormonal assay, insulin like growth factor. The other associated problems with Turner syndromes are lymphedema, that is of hands and feet at birth, then shield-shaped chest with widely spaced nipples, webbing of the neck, cubitus vulgus, that is increased carrying angle, short stature, that is uh, adult height 135 centimeter, multiple pigmented navy, and gonadal dysgenesis in 100% of the patients, primary amenorrhea, and the lack of pubertal development. Then gonadoblastoma, then renal anomalies, which is 40%, and congenital heart diseases in 20%, that is coarctation of the aorta, aortic stenosis, and bicuspid aortic valve. Then we are having autoimmune thyroiditis and learning disabilities. All of these are the associated problems along with the Turner syndrome. So the treatment options for the Turner syndrome patient is that management according to the systemic problems is provided. That is health check, regular health checks, and preventive care and treatment are important for girls and women with Turner syndrome. Growth hormone therapy is provided, estrogen and progesterone and replacement therapy is provided, fertility treatment is done, and psychosocial therapy is provided. Learning difficulties is improved, and help and support is provided to the patient of the Turner syndrome. So we have discussed the scenario of the Turner syndrome first, that there is a patient who is having short stature and webbing of neck and poorly developed sexual characters, and there is no history of menarche. So this is Turner syndrome. Then we have discussed the different investigation options, which are karyotyping and buccal smears, then the supportive investigations, and then the other associated problems with this defect. Then we have discussed the treatment options, which are the management of the systemic problems, the health check, the growth hormone therapy, the estrogen and progesterone replacement therapy, the fertility, psychosocial therapy, the learning difficulties, and the help and the support. Now, coming towards the next topic, that is Down syndrome. We are having a scenario that there is a patient who is 3-year-old child and he is brought to the clinic for not walking or talking at that age. His growth parameters are below third centile for his age. He has small mouth, protruding tongue, hypothyroidism, upward slant eyes, single palmar crease in short square hands. He has pansystolic murmur as well as umbilical hernia. So we are having some diagnostic points of the Down syndrome, that the growth parameters are small as compared to the normal, that is below third centile, and he has small mouth and protruding tongue, and hypothyroidism is present there, and upward slant eyes are present, and single palmar crease is present in short square hands. He has pansystolic murmur as well as umbilical hernia. So what is the diagnosis, the investigations with trisomy 21? What types and how related to the maternal age? What are the systemic abnormalities related to this disease, and what are the diagnoses prenatally? So we are having the definition of Down syndrome is that the Down syndrome is most common autosomal trisomy compatible with life, and the basic defect is trisomy, that is there are 47 chromosomes instead of 46. There is one extra chromosome in the Down syndrome. Now the types of the defects are trisomy 21, that is additional chromosomes 80% maternal, then translocation, which are 46 chromosomes with translocation, and mosaicism. These are the types of defects in the Down syndrome, that is trisomy 21 additional chromosome, then translocation, that is 46 chromosomes with translocation, and mosaicism. Now the diagnosis and the screening of the Down syndrome is done as the following. First of all, the clinical picture is seen, that is the clinical investigations are done. Then after the clinical investigations, karyotyping is done, that is the chromosomal abnormalities are pathognomic. Then during pregnancy, prenatal checkups are done, that is decreased alpha fetoprotein, decreased unconjugated estriol, elevated chorionic gonadotrophin in blood samples taken around 12 weeks gestation, chorionic wireless samples, and amniocentesis. These are the investigations that are done during the pregnancy. Then examination of the chromosomes in fetal cells obtained by amniocentesis or by chorionic wireless sampling is done. Then ultrasound scaling is done in the first trimester. Nuchal translucency is done, measured amount of thickness over the back of the neck. Then systemic abnormalities are checked, that is for CVS, TOF, ventricular septal defect in atrioventricular canal is present. In CNS, hypotonic and mental retardation may present. In GIT, duodenal atresia, head-sprung disease, umbilical hernia, and annular pancreas is present. Then the blood tests do for patients, that is decrease alpha fetoprotein, increase beta hCG, and decrease unconjugated estriol is present in the patient of the Down syndrome. And the question is that what are the chromosomal abnormalities you will find in the patient? Then it is trisomy 21, translocation, and mosaicism. Then question is that if mother has chromosomal problem, how will you explain the chances of recurrence for next offspring? So these are increased age and increased risk. The patient history 21 and mother and father are normal, that is 1% chance. Translocation 21 by 21 and mother is carrier, then 100% chance of recurrence. Recurrence risk depend upon the type of Down syndrome and what percentage of the Down syndrome cases have congenital heart disease and what percentage have IQ below 70. So 40 to 60% are having congenital heart disease and 50% patients have IQ below 70%. Okay. Also, it is important to counsel the Down syndrome patients. So we are having the counseling that counseling should be done about a disease and a detailed explanation that the disease is incurable and a good quality of life can be spent with a regular follow-up. Then they should be informed that they are not the cause of it. Then discuss problems associated with the disease and regular follow-up is necessary to avoid complications. Then inform about the recurrence risk and possibilities and prenatal diagnosis. Then once mother is pregnant again, she should do antenatal visits so diagnosis can be done on the time for prevention. The specific management options are therapy is directed specific problems, for example antibiotics for infection, digoxin or cardiac surgery for heart problems, and support for the parents and family planning advice is important. So we have discussed the topic Down syndrome, which is most important in the common topic, and we are having the abnormalities that there is decreased growth parameters, hypothyroidism is present, upward slant eyes are present, single palmar crease is present, and short square hands are present. Also pensystolic murmur is present. So what is the definition? It is most common autosomal trisomy. Down syndrome is autosomal trisomy, and the basic defects is trisomy, that is there are 47 chromosomes instead of 46. Now the types of defects are trisomy, translocation, and mosaicism. The diagnosis and screening are done by clinical picture, karyotyping, and during pregnancy, that is prenatal checkups, examinations of the chromosomes in fetal cells, ultrasound scanning, and nuchal translucency. The systemic abnormalities are found by CVS, CNS, GIT, and the blood test. These are the specific questions that are asked about the Down syndrome. So here is the question that why we do blood test. So it is for decreased alpha fetoprotein, increased beta hCG, and decreased unconjugated estriol. In the case of Down syndrome, the chromosomal abnormalities are these. And if the mother has chromosomal problem, how will you explain and chances of recurrence for the next offspring? So age increase, risk increase. Patient trisomy 21 and mother and father are normal, then there is 1% chance. If translocation is 21 by 21 and mother is carrier, then 100% chance of the recurrence. Recurrence risk depends upon the type of Down syndrome. Now what percentage of Down syndrome have congenital heart disease? So these are 40 to 60% and 50% patients have decreased IQ level below 70. Then this is the counseling of the Down syndrome that we have discussed, and the specific management therapy is the therapy for the systemic problems, and also for the support for parents and family planning advice is important. Now moving towards the next one, that is Klinefelter syndrome. So we are having a scenario that there is a 18-year-old boy has height of 5 to 11 but poorly developed beard and sparse pubic and axillary hair and small tests and some gynecomastia. Small testes and some gynecomastia. Okay, now this is the defect of male. That is, there is 18-year-old boy who is 5 to 11 centimeters. Height is 5 to 11, but poorly developed beard and sparse pubic and axillary hair and small testes and small gynecomastia. So diagnosis test to confirm the diagnosis, and what abnormalities will you find? The definition of the Klinefelter syndrome is that it is a syndrome having 47 XXY and an extra X chromosomes that of male. For example, if there are 46 chromosomes, then the 47th number chromosome will be an extra X chromosome. There are trisomy on 18 and 13. Now, what are the investigations options? These are karyotyping will show 47 chromosomes with XS and Y. The female body habits will be present, decreased body hair, gynecomastia, small testes, infertile sperm productivity, and behavioral problems. He will be infertile because of the reduced spermatogenesis with total atrophic testicular tubule, and the pathophysiology is the 80% is 47 XSY and 20% is mosaicism. And the treatment option is that of the same for the Down syndrome. Where is it? Counseling management. Okay, that is that the therapy for the specific problems are provided and support for the parents and counseling of the patient is done. And also this treatment can apply, that is these systemic problems can be treated for the patient of Klinefelter syndrome. So we have discussed the three syndromes, that is the Turner syndrome, the Klinefelter syndrome, and the Down syndrome, which are the genetic problems. In Turner syndrome, we are having the abnormality that there are short stature and webbing of the neck and poorly developed secondary sexual characters in the female. And the Down syndrome is abnormality in which there is decreased growth parameters and hypothyroidism and slant eyes and single palmar crease and short square hands. And there is an extra chromosome. It is autosomal trisomy, and there are 47 chromosomes instead of 46. In the Klinefelter syndrome, there are 47 chromosomes, that is, one extra X chromosome is present, which leads to the female body habits, decreased body hair, and gynecomastia. So here we have discussed all these three topics. In the next video, we will discuss the nutrition, that is marasmus and kwashiorkor. Thanks for watching.